We are moving on to the Mohs surgery. So Mohs is a specialized surgery. You should understand. This is not like the typical other excisional surgeries. It is way different from the other surgery because here what happens is the person who is actually doing the Mohs surgery, he acts both as an operating surgeon plus the pathologist. So he acts as a dermatologist as well as a pathologist. So normally what happens is the physician excises, he does any biopsy or removal or whatever he wants to do in excisional surgery and sends the specimen to the pathologist for a subsequent examination. Whereas here what happens, then and there the physician who is excising and operating the patient, he will subject those specimen to a pathologic examination and instantaneously he is going to do the surgery as well. So two roles are being taken by the same person. So that is the specialty of Mohs surgery. Okay, not all doctors might do this Mohs surgery. Doctors who are so advanced, who have vast clinical experience, would go for a Mohs surgery. Not all dermatologists focus on Mohs surgery because those conditions patients will be having like risky diseases like cancers, especially B.Sc, SCC, all those we saw. Because of the absence of melanin, the Western people are more prone to develop such diseases, right? Okay, the coding is pretty simple. You don't have to worry about it. The coding is pretty simple because here we have to see something. The physician is going to excise a tissue. It's a micrographic surgery. So the physician will have to investigate or examine the specimen under a microscope and then he will cut it into various blocks. He will mount it on a mounting medium and then he studies. So that is a block. So here what happens is in a Mohs surgery, the physician is slowly going to excise the tissue in layers. So that you call it as stages. Every layer. So layer by layer he is removing. So you need to know how many layers has he removed and how many of such blocks he has prepared.